Hello everybody, Jenny with Resolve Physical Therapy again. It's been a while since we've done a Wednesday wisdom episode, but we have another one for you today that I'm really excited for. It's on women's health, so I'm going to let Jackie introduce herself here and give us a little background on what that is.
Thank you. So my name is Jackie Smelser. I am a women's health physical therapist. I own my own practice in Bend, Sunrise Physio, where I do specialize in women's health.
Yeah, so exciting. So tell us what that means to be a women's health therapist, like the education. Did you get extra certifications?
Right.
What kinds of, an example of some of the kinds of things that you're treating for that?
Right, yep. So I actually did not know I wanted to be a women's health PT when I started. I was a general practitioner in orthopedic setting and then was asked to go to separate women's health continuing education training. And the truth is I've been doing the education for it for the last 12 or 13 years now.
Okay.
And it does require just some continuing education. Yep. And I've done a number of different programs for that, primarily Herman and Wallace and the American Physical Therapy Association. So I do specialize in women's health, but I've also done a lot of work. And by the way, we're switching the name over to pelvic health, so it's a bit more inclusive. And I sometimes forget to say that too.
Okay, good to know.
But that does include, urinary incontinence and fecal incontinence and pelvic pain syndromes, pain with intercourse. I do pediatric incontinence to pregnancy and postpartum, hip and back pain that's difficult to diagnose. Sometimes there's a pelvic component to it, like an internal pelvic component to it. Those are probably the primary, and some abdominal stuff too. Like,
oh, sure.
Yeah, there's some interesting abdominal pains that can be coming from pelvic floor.
Okay. Yeah. And so pelvic floor is definitely one of those keywords right now for a lot of people.
Right.
But nobody actually knows what it is. So
Right.
A little background on that.
Yep. I probably should have brought a picture.
Yes, that
It's a
would
little
be
easier, pictures with a million words, but in general, everybody has a pelvic floor, men and women and kids. The pelvic floor literally is the floor of your pelvis. It sits between your pubic bone and your tailbone, and it's like a bowl of muscles. I call it a sling of muscles often that holds everything in. Your pelvic floor controls bowel and bladder. It's for sexual appreciation, delivery of children. It's obviously a very important structure, and it's just interesting how little it's talked about. I know we went through 7 years of college and talked about a pelvic floor maybe for an hour.
Yeah,
very
little.
It's crazy. And so I remember when I went to my first course on pelvic floor therapy, and I really didn't know what I was getting into. And I was like, why doesn't everybody know this? This is a really important structure, and it can cause a lot of dysfunction if it's not working right.
Yes. That's a lot of people don't even know if it's muscle or if
so it's a
tendon.
big layer of muscles that has fascia and tendinous attachments. In a nutshell, for women, they have two sphincters, a vaginal sphincter and a rectal sphincter. And those structures close because they're circular, they're sphincters, and then there's a level of muscles above that I call them the lifters. So they hold everything in. So when you jump and run and cough and sneeze, it keeps everything in. Yep. But there are two different levels, and that can be confusing, like with Kegels. Yes. A lot of people come in and they say, I've been doing Kegels and they're not working. And then we'll do an assessment and we realize they are only using like their rectal sphincter, or maybe they're only using their lifters.
Not doing it correctly.
They're not, and it's just a lack of understanding of what the pelvic floor is. Right? So I do spend a lot of time educating just what it is, how it works.
Well, and I remember, I don't know, a year ago or so maybe, but there was either a continuing education thing or some kind of presentation that came on, and the title of it was To Kegel or Not to Kegel.
Yeah.
So is there sometimes when that's not a good thing?
Absolutely, yeah. I mean, first of all, are you doing a Kegel right? Like, what are you even doing when you do that? Because there's all kinds of compensatory patterns, just like with gait.
Yeah.
Is somebody walking, quote unquote, right? Are there the structures that are supposed to be absorbing force from the ground through the foot, the ones that are actually absorbing force through the ground through the foot, or are we walking on the outside of our foot and on our balls of our feet too much? So just like gait or lifting your arm or bending, right? We see all these movement pattern dysfunctions throughout the body, and you just see the the same things in the pelvic floor. So the first question is, are you doing them right?
Yeah.
And then the second question is, you're right, is
Yeah.
that appropriate exercise for you? So if you have a really, really, really tight calf, maybe you had a surgery in your knee and
Yeah.
your calf got really balled up and tight, like, is the right answer for that to do a bunch of heel raises?
Yeah.
Probably not right away, probably eccentric heel raises and then stretching and lengthening, maybe some deep tissue work on it.
Yeah.
And then retraining that muscle to engage appropriately. So just jumping right into one exercise, which everybody, it's like kind of the blanket
Yeah.
exercise to treat pelvic
Exactly.
floor, is just do your Kegels.
Yep.
Like, well, what if you have a trigger point in there? What if you've had endometriosis and you're super scarred up? What if you have nerve dysfunction or nerve damage from delivering a child? What if you have a history of sexual abuse and you
Yeah.
are always tightening and guarding because you subconsciously don't want anything to go in there? And then and then they have incontinence because the pelvic floor is so tight that it's really weak.
Okay.
And then we're leaking and we're saying just do your Kegels. And not only does that not work, but sometimes it causes more increase in pain. Yeah.
See.
Long answer to your question.
No, it's good though. I think it's important since that's the one thing some people
Yeah.
try to talk about when it's
and
pelvic
it
health. but-
obviously it can be exactly what some people
Yeah,
need, but
yeah.
and then understanding what does it mean to do one,
Yes.
right? How does that
So
work?
that's kind of the next question is like expanding on treatment that might be involved in somebody with some pelvic health issues. Since it's not
Absolutely.
just Kegels.
Yeah, absolutely. So I think I might step back and talk about an assessment, if that's okay with you,
Yes.
because I think
What
to
does that look
understand the
like
treatment,
first?
an assessment might be helpful. So in general, when somebody does come in for a pelvic health assessment, we do an external assessment first. So I look at how the back moves, how the hip, obviously a thorough history. And
Yeah.
then as far as the exam goes, looking at how the back moves and the hip moves and how they squat and how their abdominal muscles engage and where there are tightness and holding and what looks weak. And then it's really helpful to do an internal pelvic floor assessment, usually for women vaginally. Don't do this for pediatric patients, of course. But if it's, a woman, then they have the option to do an
Yeah.
internal assessment or not. There's definitely ways to get a good idea if the pelvic floor is working appropriately externally.
Okay.
But gosh, it's
So
so much more
better.
helpful to really see how it's engaging internally. And I go through a thorough education on what I'm going to do and how you're gonna try to do what I'm asking you to do, which is tighten these muscles.
Yeah.
And then scan around the pelvic bowl and look for areas of tightness and pain and tenderness. And we are engaging the whole time, like we're looking at each other the whole time and talking about what they're feeling, what I'm feeling, and giving them, a heads up on what that looks like.
Okay.
So yeah, usually there is an internal assessment,
Okay.
but gosh, if somebody just does not want to do that, we can get by
Work
without it.
around
Yep.
Okay.
And then as far as treatment is concerned,
Yeah.
of course, it depends on what you find. And there's a variety of treatments. One is educating the patient in how to engage their pelvic floor and then how to let it
Let
go.
go too.
And then how to coordinate that with your abdominal muscles or your gluteal muscles, the muscles that are surrounding the pelvic floor. So often it's not that they don't have the strength, it's that they don't know how to time it.
Okay.
So if somebody, coughing and sneezing and
Yeah.
laughing, those are activities where people usually do have an incontinence
report
issue.
that.
Yeah, leakage of urine or feces. And so oftentimes, as they inhale and go to cough or sneeze or laugh, they're going to engage their abdominal muscles to push the air out this
Mhm.
way,
Mhm.
but their pelvic floor didn't kick on quick enough. So I always say, it's like a balloon. Your trunk is like a balloon, and when you inhale, it fills with air. And then when you go to exhale, if it's the abs kicking on first, if the timing is off, because it's supposed to be your pelvic floor first. There's been awesome research showing they put fine wire electrodes in the abs and the pelvic floor, and they find the timing, and people that don't
Okay.
have dysfunction, the pelvic floor kicks on first. And we're talking milliseconds, but it's
Still,
important.
Yeah.
So if the abs are engaging first, it's like squeezing the balloon in the middle.
Okay.
So air goes that way when you cough, laugh, or sneeze, but then things go south when we don't
Yeah.
want them to. So sometimes it's just training them that as you exhale, we do a lot of breath work. As you exhale, that pelvic floor closes and lifts, and then the abs
Okay.
draw in to get the timing down. And it's really just like people with back pain, where their transverse abdominis isn't kicking on,
Yeah.
the timing is off, right? They move their arm and their leg before they stabilize through their trunk. So it's retraining the timing and the coordination.
How about that?
So there's that. Definitely often manual therapy. So
Yeah.
if there's a really tight pelvic floor, then you would do internal manual therapy. I'll have them buy a wand, pelvic wand. It has like a certain shape to it, and they can do that at home to release their pelvic floor internally. There's education in dilators, so those are medical grade vaginal dilators, or rectal dilators too. If somebody had, say, radiation because of cancer down in their pelvis and things have really gotten scarred up and tight. Again, a history of sexual abuse, maybe scar tissue from an episiotomy or C-sections. It can be adhesions down in there. So training them on using these dilators that are graded to train their brain that it's, you know, if I put something really, really small, like a small stretch on the vaginal canal that doesn't hurt really bad, now I can practice relaxing it and breathing. Because oftentimes if you have, you know, somebody with some of these syndromes have intercourse, it's really uncomfortable. And we all know when we're in pain, we like tighten and guard more. But the problem is it's tight and guarded already. And so to retrain the brain to relax the pelvic floor as there's penetration with a vaginal dilator, that can be really helpful. There's, you know, all the modalities. There's biofeedback is common. So you can do an internal vaginal or rectal sensor or external surface sensors around the anus, or usually around the anus or the perineum area. And then it's attached to a little machine that says your muscles are on too much, or on, and this is how on they are, and then this is how off they are. It's nice for people to get a visual of that, right? And they're like, oh my gosh, when I stand up, it goes way, way up, and that's why I'm having more pain there. So biofeedback can be helpful. So much education, a lot of talking, like right now. A lot of talking, it's so good. This is such an area of medicine really that's just been missed. It's just something that we haven't talked about. And just sitting and talking about it and teaching people the anatomy and how these areas function and what normal is and what the goals are, that you shouldn't pee in the middle of the night, actually, you know, and if you do, that's a symptom. And so retraining that.
It's normal, it happens, but it's normal to get it to be fixed.
It's common, it's common. It's all these things are actually
treatable.
really common, but there can be symptoms of something. And you know, the great news is when people kind of connect to it, you see them light up. You know, it's actually why I named my company Sunrise Physio. You see like this light return in people. They feel empowered. They feel strong.
Especially
they feel
for something like this.
When for most people walk in, it's been years of having these symptoms because our culture, we haven't really addressed it in medicine super well. Much more
It's
lately.
getting better.
So much better. Yeah, I love it.
So are you typically seeing just females that have had babies?
Lots of that, But you know what's super cool is over the last 12 or 13 years of doing this, you know, I did used to not see a lot of that. I saw it, you know, women that were 60 and maybe perimenopausal or postmenopause, where estrogen levels decrease and then the strength of the muscles really decrease, because estrogen helps blood flow and bulk the muscle up. So you'll see atrophy in the pelvic floor, and that's when incontinence symptoms and dryness and pain with intercourse, all those symptoms can really increase. So I used to see a lot more of that age range, and now I'm literally like the PD. I had a 10-year-old in this morning, and fecal incontinence, and we are gonna rock this. It's like so cool. I'm like, oh my gosh, we're gonna prevent so many issues. You know, I help you prevent so many issues. Seeing a lot more teenagers that aren't accepting that they're having pain. And oftentimes when kids, you know, they're younger, it's more abdominal pain and hip pain, but having them learn how to relax everything and then engage it properly can be really helpful at a young age. And then definitely pregnancy, postpartum. I'm seeing women now come in before they're even pregnant, and they're like, I leak just a little bit when I jump and run and cough, and I'm afraid it's gonna get worse when I get pregnant and have kids, so can we work on it now? I'm like, yes, dude, this is awesome. Totally, I probably won't see you later, you know? Like, you just save yourself a lot more PT down the road.
Preventative even.
Absolutely. And like moms talking to their daughters. I just feel like I'm proud of the world.
Hopefully we continue to see more and more referrals. You know, because some people don't even know.
No.
Still, that's even an option. And that it comes from a PT, you know, or something along those lines. So hopefully, OBs and those types of people just continue to just automatically go see this person.
Absolutely.
Make it better. This is kind of a a big question, because
Yeah.
of course it's gonna depend on the person and kind of their diagnosis, but we often get asked, like, how long should I expect to be seen by a PT?
Yeah, that's a great question.
For some pelvic floor issues.
Yeah, sometimes once.
Okay.
A lot of people, and I love this, they're just coming in for some education. They're
Okay.
like, I've heard this is a thing. I
Yeah.
don't know if I have a problem, but can you check it out? We'll talk about this. What should I be doing to prevent this from getting worse? So sometimes it's just once. There's just so much education. And I, like you, would just do the no aids and just one-on-one, full
Yes.
hour. So it's just, with myself the whole time. So we can get some quality education in one visit. Sometimes it's up to 20.
Okay.
That is not common, but it
But it
can
can.
happen and I would go, I'm just thinking of a few patients right now, and generally there's been a history of some sexual abuse and learning to let go, or some pelvic pain syndromes maybe related around surgeries in the past that have just
Okay.
weren't rehabbed. I mean,
Okay.
there's all these pelvic surgeries and nobody does rehab for them. I mean, now they are more, but it's, 20-year ago pelvic surgery.
Yeah.
I would say the most common is somewhere between 3 and 6 visits, though.
Okay.
It's a really long answer
That's
to your
super
question.
doable
but
though,
yeah,
right? Like, that's
yeah,
so doable for
yeah.
such
And
a
just
problem.
one can be helpful. Yeah, just one.
Okay.
And
so
it can be spread out too. That's important
Wow.
because so many people have high deductibles or
Yes.
cash pay. So it's not like your ACL rehab,
Yeah,
or
or 2-3 times
post-surgical.
a week for.
Yeah, no, I'll see people once a month, I'll
Okay.
see people once a week, I'll see people quarterly.
Okay.
It can really be spread out, especially for, chronic management of a chronic
Love it.
problem, yeah.
Now, so Sunrise Physio, you're up in Northwest Crossing
Yeah.
area.
Yeah.
Accept insurances?
Yeah, I do accept most insurances.
Okay.
I've been by myself for the last
Yeah.
number of months, and so I've been limited in my ability to accept all the insurances. But I am expanding on December 1st, and at that point, I hope to have more of a staff that can help me with
For
that and
that.
take on more insurances.
Otherwise,
That's one of my
cash
goals.
options
Yeah, I do have cash
are
pay options as well.
available,
Yep.
so, okay, fantastic. Anything else you wanna share with us?
No, thank you.
Yes, thank you so
Like
much. I'm
people like
excited.
you bringing me in to share what I have learned is just super cool. The fact that you value it, I really appreciate it.
Yes, thank you for coming chatting about it, because again, we want to
Yeah.
keep it as something that should be talked about and should be very well known for all females. This is available, so
Yes.
please use Jackie Sunrise Physio, and thanks for listening.
Thank you.